looking. Now,
That one?
there's one
Yep.
right around there, and it's often right down, and you should be able to clearly feel a little joint line.
Yep.
On this one you can't quite
Yep,
so easily,
that's
but
it
it's
there.
about there.
Yeah, that's it.
Okay, and then there's often one at the very top,
There? Mhm.
about there. And so, is it sore there too?
Yep.
Okay, so you can nice and clearly find the joint line there. And then there's another one round here that is always tender when, or not always, it's not as often. The three of them vary a bit. So there's one round there. Is that one tender?
Mm.
Okay, so it's right on that joint
Yeah,
vein.
you found that one. Yeah, on this hand, yeah.
It's right on that vein, unfortunately. So there are the 3 or 4 points to find on that one. So you can share your hand with those
That
people.
one? Yeah.
Well, I mark these ones. There's a nice clear little ditch in there.
Yeah, yeah. That
And-
gentleman picked that up. Yeah,
And it's up there at the top,
Yep.
somewhere
yeah
there.
you
there,
got it.
There. And then a nice
Yep.
little hollow
Yeah,
in there.
that one. That one's not as bad as that's, yeah.
That's the other one.
Yeah.
Okay.
Yeah.
So have a feel of those, and what you're feeling for is a little ditch like that in
Mm.
between two joints.
Yeah. They've...
NaHCl, the hydrochloric acid tablets.
Oh, yes. I had a lot of reflux, and I went to my GP. On 2 occasions I've had a fallout with my GP. He had me on HRT, and my sister-in-law went to Margaret and said, "You got to get off that stuff." And I spoke to my doctor, and he said, "No, you can't do that, no." Anyway, I went to Margaret and asked her about it, and she said, "No, you've got to go on to progesterone cream." This is digressing from the other story. And my doctor really went ballistic and was furious. Anyway, I went off the HRT, and this is going back, I'm 63, so this is going back,
Many years.
oh, 10, would it be? Yeah. And I went on progesterone, and I mean, I've never had menopause. I don't know what a sweat is. I don't
So
know.
why were you on HRT if you didn't have
Well,
hot
he
sweats?
was preventing, he said I must be nearly menopause. He was preventing hot sweats and menopausal symptoms.
That's what we used to do 10 years ago.
So I
because
went
we
on
really believed that it
progesterone
helped.
cream and very limited amount, and so I've never had menopause. I don't know what it is, what you know, whatever the ladies go through. And when I hear ladies talk about it, and I went to that show that,
Menopause coming up.
yeah, and all these women saying yes, that's, and I'm thinking, they're weird, you know. And when I said, "Oh, I don't have any of that," they looked at me and went, "Lie, lie," like the lady in the show. So I don't say anything.
Don't say that too much, so they'll scratch your eyes out.
Yeah, and you
No,
know,
you're talking about that musical.
yeah,
That's
yeah.
right, yes.
And I just found that, you know, I haven't experienced any of that, and I do put it down to the progesterone cream. And then I had reflux, chronic reflux. And it was giving me really big trouble, and my doctor put me on Zantac. And my husband said, "You've got to go and talk to Margaret about this," which is, we just started hearing about Margaret. Matter of fact, I reckon Alan went to you before you was even on Glen Osmond Road. You were somewhere.
Over on Balliol Street.
Yeah.
Yeah.
And so when I went and saw her and showed her the Zantac, she said, "Oh, you can't have that," and she picked it up, and in the bin it went.
I can't remember doing that.
And she said, "I'm going to give you a test for hydrochloride." She said, "And I want you to take so many tablets, and if that's, you know," and that's what my trouble was too little acid, not too much. And he was treating me for too much, and I was really, you know, worse taking Zantac because I didn't have enough acid to digest, and so I take a Zantac, hydrochloride regularly. Yeah.
And what happened to your fingernails?
Oh, I've got fingernails.
What were they like before?
Oh, like paper, breaking off. I've got fingernails. And
They often peel. So one question
mine
to find
did.
out
Mine
if
did.
people have got low stomach acid, what happens with low stomach acid is they're not absorbing their minerals. And so their fingernails peel back like that. You know, that sort of peeling
they did,
fingernails.
and mine was so bad they were getting, I couldn't get them clean because between the two layers, the top was peeling back. If I was gardening, they would stain. They were so bad. But as you can see now, I've got...
Beautiful.
Yeah, and my husband was having trouble with his nails, and it was actually at one of Margaret's workshops. She was telling them about hydrochloride for nails, and I thought, oh, that's what's done that. So I went home and told my husband, so he's taking it regularly, and his have improved. Yeah. So
So that's quite, if someone comes in with
Did he have
reflux,
Did he have reflux?
no, he didn't. But he takes it for digestion anyway. Or anything
He's
Margaret
very-
has.
he's very keen on vitamins and things.
Natural.
Yeah, he came to me for chelation therapy because he had high blood pressure
Heart.
and heart trouble.
Mhm.
And he's still got high blood pressure, but hasn't he? But
Yeah, but it's pretty
it's
well
very
under
mild.
control.
Yeah, pretty well under control. So if a person comes in with reflux, the reason the stomach is refluxing stuff up into the esophagus is not because it's got too much acid. It's because the stomach doesn't empty on time. A healthy stomach should empty within an hour of a meal. And if it doesn't, it's because the stomach's not producing enough acid to stimulate peristalsis. Peristalsis eventually becomes strong enough, as the acid becomes strong enough, to stimulate the pylorus to open and this big squirt of stuff to go into the duodenum. Now, if that doesn't happen within an hour of a meal, the person lies down 5 hours later at bedtime and it all refluxes up into the esophagus. And it doesn't mean that what refluxes up into the esophagus has got no acid, because it's got some. What we're looking at is an epidemic of hypochlorhydria, not achlorhydria. Achlorhydria still exists, but it's not that common. But hypochlorhydria is very common. And so if people come in to you with reflux, give them a sample of 6 hydrochloric acid tablets. The first night they take 1 in the middle of their main meal, because you want this tablet to get right into the stomach. You know how some people are not very good at swallowing tablets and they get stuck in the cardia. So it has to get, so you tell them to take it in the middle of the main meal so it gets right into the stomach. Then if that doesn't give them indigestion within half an hour, then the next night they take 2 in the middle of their main meal. And if that doesn't give them indigestion within half an hour, then the next night they take 3. And if they can take 3 tablets of hydrochloric acid and not get indigestion, then they haven't got too much acid, they've got too little. So then you get them to take 1 with small meals and 2 with main meals over quite a period of time. Young people, within a few months, they'll be absorbing their minerals enough, particularly their zinc, so that they will soon start to get indigestion because they'll be making their own acid. Because acid is produced in the stomach with an enzyme called carbonic anhydrase. And carbonic anhydrase is a zinc-dependent enzyme. So if you haven't got enough zinc, you can't make this enzyme, and therefore you can't make acid. And if you haven't got enough acid, you don't absorb zinc. So it's a circular process. So using this knowledge and supplementing hydrochloric acid and zinc, except in the very old people, you should be able to get most of your patients off your acid-lowering drugs. And
Where does he look at Bachelor pylori come into it?
well, it lowers stomach acid as well, so you don't want to miss some of those. But did I put it in your notes?
You did, yeah.
There's an article that I put in there that acid-lowering drugs are causing osteoporosis. Is it 4 times the incidence of osteoporosis in people who are taking acid-lowering drugs? It also causes osteoarthritis because, you need minerals to keep your joints good too. So we're creating an epidemic of malnourished people by suppressing their stomach acid. And what we should be doing is correcting their stomach acid so that they can absorb the minerals out of their nuts and wholemeal bread and all these things that we do eat if we're lucky.
What do you call a young person then? And
Up to about the age of 50, 60, somewhere around
So
like
they're
that.
going to need a few months of the course?
Yeah, within a few months it'll start to cause acid and, to cause indigestion when they take it, and then they stop taking it.
So they'll notice they get reflux
No, they won't get reflux, they'll get indigestion.
of just burning here.
Yeah. Yeah, so come and have a look at me doing the thumbs.
I don't watch this.
You know what, we will. Look at
At a 25 gauge needle.
Yep.
Yep.
the
That's the smallest one you use, Margaret, is it?
No, I'd use a 26 if I had it handy.
How would you?
Now I've gone into the joint now, and sometimes when you go into the joint you feel the digit move beautifully as the joint fills up.
Why didn't
I
you
went
try
one-
to hit bone and then?
I did.
Oh,
I
you
touched bone first
Yeah.
on each side, one side,
Yeah.
and then the other.
Yeah.
And
a
then
little
I
bit
decided,
longer.
oh, let's
Yeah.
try and go into the middle, and the needle went in further,
Slides in.
so it's gone right in
And
to the joint space.
The thumb moved there, didn't it?
Yeah,
Sorry.
yeah.
How much are you putting in the joint then?
Oh, tiny, like
Ah.
0.1 of a cc
0.1.
in each dot.
0.1, right.
Yeah, tiny little bit. Touch bone. Now this would be a good time to aspirate because there's blood vessels around here, but I don't always, I must say. And it was this one over here, I think, that caused the neuropathy in this other lady. So I'm going to be very careful from now on when I put the needle in to just wait for a second and make sure they're not jumping in agony and then inject.
But that neuropathy is only transient, isn't it?
Well, yeah, but it's been a few months now
Yeah.
and I don't like that. I hate causing any trauma to my patients. So that's that one. You brave girl, thank you. Now the other hand.
Oh, look, the other way now.
Yeah, the other way.
You just wanted to stare at me.
I was trying to work out, are you Irish or what?
Yes, he's definitely Irish.
Strongly
Well,
Irish.
you know, Odlum, my
See, this is a
surname,
good
are
hold.
Irish.
Odlum. Oh yeah, Odlum's flower, yeah.
Yeah,
Yeah.
They're very famous.
yeah. Well,
Big
Alan's,
If you're
it's
related,
gone
you'll
right
also
in,
be worth a
see?
few dollars.
no, he
So I
sold,
wanna- I
Lo-
wanna
Loftus
touch bone.
sold about,
So
I was
I've
over
come back a
in
bit.
Ireland in,
Oh, no. There it is, now I'm touching
98.
bone.
So you from Dublin?
No. Galway, the other end.
Oh, yeah, they're from Portlaoise.
Oh yeah.
Yeah.
Wealthy enough spot.
Mm.
It's a garrison town though as well. It's a bit rough. You know,
Mm.
the edges.
That's not going down your finger, is it?
No.
Oh, I've got all this zeal still left.
I'm around
Do
out there
it.
one night to a dance and they were
That's
bumping
right,
into
yeah.
me, spilling drinking over me. There weren't too many people saying I'm
coming
sorry, so it's a bad sign. I took off. The army, you know, the army towns can be a bit rough.
Now, I've still got a bit of your magic zeal left. Is there any other joint that needs a bit of treatment?
Oh,
So with the veins, what do you do to create synostonovitis?
I don't know.
Do you use
Is this de Quervain's? Because I'm really sore about there.
I thought
is
the
that
veins,
Styloid.
yeah,
It's a
the
styloid,
veins
It's up
is
here.
that tendon, isn't it? It's thick and swollen.
Okay, well, I haven't actually ever seen one, funnily enough.
Can you show your pain again?
And mine's about there.
Okay, you
It's the
may have
styloid, yeah.
you may have Guillaume's or Guyon's Canal syndrome.
Ions what? Syndrome?
You know, the carpal tunnel syndrome.
All
There's
right.
another tunnel goes along that way. I don't remember the exact anatomy.
Well, I think once I get round to it, I'll get a needle stuck in there
Yeah.
because it feels like I've got, what's been happening is because I've got a sore left shoulder, I've been doing push-ups at the gym and putting most of my weight on this hand.
ooh.
And now I've sort of strained
Get out
it
of
there.
whack.
Yeah, I tended that too.
Yeah. So do you want this little bit of zeal and prolo in any other joint?
Oh, where do you suggest?
Well, you're so darn healthy, you don't really need it, do you? Wonderful, healthy woman this is. She's a perfect example of long-term nutritional therapy.
How old are you, do you want to be honest? How old
How
are you?
about these joints like this?
How old am I? I just told, how old do you reckon I am?
Is that tender?
Dangerous question, yeah.
I know, 60,
Especially if the edge of your ears
I'm
closed about
63 and a
2 minutes ago.
half.
That's what you said.
Yeah,
63 and a half.
63